lid, cryolid, and it is made of the aluminum or the steel. And it has got a pressure releasing valve. So in case there is increase of pressure, it will. Now it is put on a ACP or a steel whenever we use while using this cryocans, stainless steel. Now the lid will open like this, and it contains a liquid nitrogen. So in this cryocans, it has got a 1, 2, 3, 4, 5 canisters, and each canisters we have the exact this liquid nitrogen is here. Okay.
Hello everyone, I'm Dr. Anupma Gupta, hands-on batch 126 C1, and I am demonstrating
the capability of holding syringe to learn
the capability of holding syringe
and depicting the meniscus here in holding the egg. Okay, so now you release the egg.
Hold the egg.
Hold it. Release the egg. Yes. Hold the one. Release. Hold. Release. Hold.
I'm Dr. Arpita. This is a workstation. It's a 6x2 workstation, especially made for handling the embryology part of overhandling. And then we are concerned that how we should clean this workstation. We need to clean it daily once the work is all finished up. What we are recommending to clean it is, first we have to wipe all the dust and visible dirt with the plain with the medical grade water, distilled water, and then we should be using safe blue color, it's a blue color.
Yeah. The water to use is a IVF grade water.
IVF grade water.
Grade water.
Yes. Grade 2 water.
Grade 2 water.
Yes.
Am I right?
Yes. IVF grade 2 water.
So it's a lot of learning we have, which is very interactive. So these are my memories, so I show these videos for the people to connect with me. These are few courses. Course 1 is on IVF embryology and lab setup. Course 2 is on IUI embryology, and course 3 is on IVF. So that's about protocols in IVF and how we do the IVF. So we are having these curtain raisers. CR stands for curtain raisers, and these are the ones which we plan around 3 to 4 months in advance. So today we are at curtain raiser 86, and that's today the Friday. So when we look at it, we have planned till 7th November. So we are all booked. We have planned our schedule till 7th of November. Very good topics coming up in case you want to join. It's OPU, sexual dysfunction, lab setup, PRP, semen analysis. So we keep doing these CRs like you are attending today. Topic for today is IUI, and upcoming is OPU. Then we have got male sexual dysfunction. These are a few creators which we have created. PRP, I'll like you to all attend. That's a new topic. And yes, so we have got alumni grooming program where we invite our alumni for Facebook live programs, so they can get groomed about how to speak on the camera. So we keep having them, and all the topics are being covered, and these are our alumni, where we had Dr. Babita, we have Dr. Arpita, Dr. Pratyush, so here we have Dr. Vidya. One of more songs.
जो दिल से लगे उसके दो ही हाय हाय हाय, जो दिल ना लगे उसके दो बाय 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 बाय, आने दो दिल में
Today on 29th May,
These are
we had our second day of
hot-
our hands-on training program, batch 122, course 3, C3. Today we learn about the andrology, azoospermia, and IVF lab setup, costing, basic requirement, and specifically by sir mentioned that what to not to buy. Which is much more important for us because we don't know about how the things are going on.
Hello, I'm Dr. Anuradha from Hyderabad. I've come here to Dr. Pankaj Talwar's hospital to do my hands-on workshop. This is the 126th workshop sir is conducting of the C1 batch. C1 batch basically includes a lab setup, then the cryobiology and also about the ICSI. And I really got to learn a lot, which I don't think I would have learned in any other place. Sir goes into all basic details, all the nitty-gritty details, which we will not even find in our textbooks. So there's lots of hands-on and also a lot of practical knowledge, and at the same time, a lot of theoretical knowledge as well. And our stay also here was very comfortable. Thank you, Dr. Pankaj. And
Myself, Dr. Sudhir Gupta from Gorakhpur. I have heard about the Talwar sir, and because nowadays infertility is increasing day by day, and I'm a gynecologist, a lot of patients comes to us for the infertility treatment. So I decided to do some courses, some training for the IVF, but for going the fellowship and the other courses, it will take a long time, 6 months, 1 year. It is not feasible for we people who is working and having the some hospitals are. So the Talwar sir course is very nice, and the important thing is, the best thing is, sir is making this
Intra
IVF is so
being
easy that anyone can learn and start IVF by own after their sir course.
Hello, I am Dr. Indradeep Bandyopadhyay. I have come from West Bengal, Asansol. I have brought a kind of a sandesh which is very special in Bengal. It is actually called as Jal Bharaha, in the sense there is something stuffed inside. It's obviously not Jal, but there is a kind of a gur which is called as Nolen gur. I think, yeah, it's that one only. So
now as I go to the class for the day, the new version of our academy. The few pictures I'm just for the last few batches, and it'll take around 3 minutes more. Then I hit the topic for the day. These are our ultrasound courses which we do, and this is all the few memories of the past 3 to 4 months. There's a certificate convocation ceremony which we do. So I just want to connect with the old faces, old friends before I forget them with my gray hairs and graying cerebral cortex. So good memories. I hope you people, some of you are here today to look at your pictures all around. Yes. So our next batch of the ultrasound training is on 28th of August, and we'll do it every month in case you want to enroll. The 3D course, you can join us, and we have Alumni Connect program only for alumni. On big demand, we are having the course on FET. This is from the recent batch. They want me to talk on FET protocol, so we're going to have it on 14th of September, 5 to 6:30 p.m. That's for all the batches E1 to E22 till date. So anyone can join. You'll be given a link, and recordings are not available, of course. We had 2 lovely lectures on ART laws. That was again for batch E1 to E21. We had it on 14th and 15th of August. I hope you enjoyed them. Now coming for the topic for the day is on IUI by numbers again. And now I move on to the 10 commandments of the IUI again. So back to school days. Sure. I'll go to, we take blessings of Lord Siddhi Vinayaka every time. And now what I say is that you can take your copy and pen with you. Please take a pen and pencil with you and keep noting down some relevant things which I'm going to tell you. I have with me around 45 minutes to 1 hour. And I'll talk about a topic which I have to repeat every year because people want me to repeat it. So it's an important topic. And that's the fundamental when a woman goes to a doctor or the male goes to a doctor, they have been advised some treatment. So looking at the icebreaker round. I just want to ask you, how many of you here do IUI, or anyone here who's not doing IUI in the whole crowd here? Anyone who's not doing an IUI here? How many have got a level 1 center here? I want to ask you. How many of you have got a level 1 center? Can you say hello? Hi, Shruti, how are you? How many of you have got a level 1? Just want to have some idea about whether have you got your center registered or not. So if you
Hello, sir. I'm Dr.
So
Suman.
this is conditional situations, ma'am.
great. So all of you who want to do an IUI or who have not done an IUI, please get your center registered. It's a level 1 unit. And how much money do we have to pay?
50,000. 50,000.
And you know how to do it. No? We have learned how to go to the website and fill the form, get a PDF, attach it. That we have done. I'm sure that all of you will be using HMG and FSH. And a lot of you would have seen multiple pregnancy and ovarian hyperstimulation. And I differ a bit from the Western data. I keep asking that how many of you have got ovarian hyperstimulation and embryo multiple pregnancies, IUI versus IVF? So answer is always IUI at the end of the course, and that is correct. We have more problems with the IUI cases now, not with the IPF, in case you are properly trained. If you're not trained, then the ratio can reverse. So this is an PCO ovary. Here we can have an opportunity to induce this girl who comes to us. It's a PCO ovary here. And PCO, I look at 3 different conditions. So gentlemen, ladies, today as I'm with you, I talk about a case of unexplained infertility where we don't know why she is not conceiving. And unexplained infertility. We don't have any reason there. Second will be endometriosis, which is pretty common. Third will be poor ovarian reserve when her count is pretty low. And the fourth one can be PCOD. These are 4 conditions which come to us routinely in our practice. So I'm going to talk about all the 4 conditions separately. This is a PCOD ovary, and I think that's it from my side. This ovary is probably a failing ovary where we get less amount of follicles in front of us, low AMH, low AFC. As I always say that when I go to IUI, the whole concept building will be different because IUI has been given a big punch on the face due to something called NICE guidelines. NICE guidelines have been coming repeatedly. Twice they have come and they have said that go backward and move towards IVF. So I'll show you these guidelines again in some time. So the debate is, should we do IVF or should we do IUI? That's always the debate. And I always say that as far as I'm concerned, we should always go in for an not even IUI. I believe in time intercourse. In case it doesn't work, then I go to IUI, and then I go to IVF. There are 2 different ways, and all of you who are part of our alumni team, time intercourse is sorry, I wrote TO. It is time intercourse. That's my favorite way, where people really have very good outcome. In case you can predict their ovulation, that is important here. The ovulation is important here. That's very important for us. And then, are we overusing IVF? This is one thing which actually hurts me every time. Are we overusing IVF or IVF? Why are we doing IVF? So many IVFs I don't know. Every second girl who comes to me, वो एक ही बोलती है मैं IVF कर दूं. As if there is no other way she can conceive. So I really don't have the answer, but I'll try to get to an answer today. So are we overusing IVF? This is what I will talk to you today. This is my favorite picture I use in every IUI class, that people want quick answers, but it's up to us whether we give our children Maggie or not. That's our choice, whether we give them junk food or not. But all the children want Maggie, ready-made food. Same way, majority of our cases, they want ready-made, quick outcome. Quick outcome will come from by giving them IVF. So they want instant gratification and they want it now, not later. And then they want good results which can come immediately. So for an IVF, I think average outcome is around 60% for us. But when we talk about an IUI, the outcome is barely 12, 13, 14%. a big difference in the outcome which occurs IUI versus IVF, and that also always gives us some amount of challenge. Now coming to the IUI basics, look at the IUI basics. Here we all know about IUI. How does IUI work? This we are aware of, and we are also aware of that IUI is a very simple method. Doesn't give you any problem. You can easily do it, and sperms are here injected very easily inside the uterine womb like this. So there is not much of a problem when we carry out an IUI. Simple method. It takes some amount of care, but very easy to do. Anyone can do an IUI. Now, coming to artificial insemination, we can do IUI by the donor or we can do by the husband. What forms do we have to fill? Anyone of you? What forms do we fill in case we are doing IUI with the husband semen sample? Any one of you?
Form 7.
7 and 8.
7 and
Donor form 8.
7 and 8. Okay. Yeah, 7 and 8. Very good. Very right. So this is the common causes of doing an IUI. There are cervical factors, mild endometriosis. So when the couple cannot have a normal contact, or there can be low sperm count. These we all know. Actually, we have evolved. Nowadays, you people have all evolved, and I won't waste your time in talking about these indications. And the end point is that we want an infection-free sample. Good tubal patency should be there, good sperm count should be there, and age should also be good. So age is very. And then some people we also do IUI when there is no male partner, same-sex couples. There is some genetic disease in the man, then we or a donor sperm, or we can do sperm quality is very poor, or there is some HIV or something. We can go on for a donor semen sample. We stimulate letrozole or clomiphene. May give them some HMGs. We carry out sperm preparation, and then we give them luteal phase support, and that's the way the whole IUI